The risk factors for heart attacks can include elevated cholesterol levels, increased blood pressure, tobacco use, diabetes, and a family history of heart disease, just to name a few. Dr. Heiner Vogelbach at Methodist Hospital in Arcadia tells us what happens during a heart attack.
The heart attack is when one of your coronary arteries is blocked. The majority of heart attacks is caused by blockages less than 50%. And those are the ones, the blockages which you don't know about. They don't give you any symptoms. They don't give you chest pain or don't give you an abnormal stress test or an abnormal EKG. What happens is the inside of the blood vessel has a lining, the endothelium. If that ruptures and there's a little blockage with a little cholesterol in there, and the cholesterol is covered by a fibrous cap. If this fibrous cap gets inflamed, it tends to be frail and rupture. And once the blood is exposed to the lipid, to the cholesterol, and these other inflammatory elements in the atheroma, a blood clot forms very rapidly, abruptly, and unexpectedly. And it can either block the artery completely, and then you have a heart attack, or partially, then you may get chest discomfort.
Dr. Vogelbach talks about cholesterol and how statins can help.
We have the bad cholesterol, we have the good cholesterol, and we have the triglycerides. And so for every age group or for a certain risk profile, we established some guidelines what your bad cholesterol should look like. And we treat it accordingly with statin therapy, which are very effective medications to lower the cholesterol, prevent the buildup of plaque, and reduced heart attacks and strokes by about 35%. What we know now for many years, coronary artery disease is an inflammatory disease. There's inflammation inside the arteries. And I mentioned this fibrous cap. It gets weakened by inflammation. We call that vulnerable plaques. And those are the ones which tend to rupture suddenly. And as it turns out, statins are the most effective anti-inflammatory drugs.
For people with a family history, should they get a stress test?
With the stress test, we will only detect patients who have already a 70% or more blockage. What I would recommend at that point, besides of course controlling your risk factors as much as you can if you are aware of them, you know, cholesterol, blood pressure, diabetes, and so on, a little overweight, a little exercise, all the usual things, I would do a coronary calcium score. That's a CT scan of the heart where you measure the calcium in your blood vessel. Now, if you want to go a step further, CT angiograms. Now, that's a very interesting test. You get a little injection here, nothing from the groin, no catheters, nothing. With one breath holding, you get a beautiful picture of your heart. So there are non-invasive tests up to an angiogram which can really tell you, hey, do you have a real problem or you don't. With a 70% or more blockage, we tend to intervene. Intervene means we put in the balloon in a stent. That's the most common approach. If you have multiple blood vessels with significant lesion, you still may end up with a bypass surgery, which we utilize much less nowadays than we used to. If there's a question, should there be a stent or not, they have a wire technology where they put a wire through the lesion, give a certain medication, and they can determine how significant this particular blockage it really is. The heart, of course, it's not a localized disease, it's a systemic disease. It can hit your carotid arteries, your kidney arteries, your leg artery, the strokes, and so on. It's everywhere. It's a systemic problem, and once we identify it here, we always look everywhere else, and we have to be aware to have a surveillance in place for all vascular beds in the body.